each other. Okay. As I notate the scalp, I notice that he has flat, coarse hair. It is sparse in some areas, but there's not any indications of alopecia, which would be great circles with no hair surrounded by an increased amount of hair. Okay, so I'm just going to rub my hands on her scalp. Do you have any pain? Okay, I don't notice any lesions or any prominent indentations or depressions or any noted trauma. Have you been in a car accident or anything involving a head injury? Any trauma?
I was in that car accident a few months ago, but nothing.
Did you hit your head?
I didn't hit my head.
Okay. Okay. I also don't notice any parasites or infestations on the scalp. Okay. Well, also being at the head, I'm going to assess his temporal artery. Okay. They are, he has moderate pulses, which I would rate as a 2+. As I note the symmetry of his face, his nose is proportionate and midline. As I note his eyebrows, they are symmetrical, they are sparse. He has sparse hairs on both the right and left tail of his brows. His eyelids and eyelashes are symmetrical. I don't know any hairs missing or sparse lashes. There aren't any infestations on the lashes, any mites or other parasites. Yeah. Okay, we're going to check the maxillary sinus. Feeling tenderness or pain there? All right. Now we're going to assess for range of motion. Can you hold your head back for me? Okay, hyperextension noted. Do you chin to chest? Okay, flexion noted. Can you turn your head to the left? Okay, can you turn it to the right? Okay, can you try to touch your left ear to your shoulder? And the opposite side. Okay, we notice that he has right and lateral flexion. Okay, we notice that he has right and lateral flexion. Is there any pain with any of those movements? Okay. So now we're going to assess the salivary glands and lymph nodes of the face. Okay. Let's see. So can I get you to turn to the side for me? Okay. Now we're going to assess the lymph nodes. Okay, first we're going to assess the pre-auricular and the post-auricular. I'm going to assess the occipital, the tonsillar or jugulogastric. I'm going to move my way to the parotid salivary gland, the submandibular, as well as the submandibular gland. Okay. Let's see, can you open your mouth? Okay. So to find the sublingual, I would locate his right and left canine. And using above. Knees over down. And palpate the sublingual salivary gland. Alright. I'm going to then palpate the submental. Going to palpate the superficial clavicular, as well as the deep clavicle chain. I'm going to move down to where the clavicles are and palpate the supraclavicular lens. Okay, did you have any pain or tenderness when I palpated those lens?
It's actually kind of relaxing.
Relaxing, okay. So now we're going to assess the trachea. Okay, you can hold your neck up for me. You can tell me if there is any pain or tenderness. So as I assess the trachea and its midline, any pain? Okay. I don't notice an increased thyroid gland, noted as a goiter. Can you swallow for me? Okay. Again. While his head is at a 45-degree angle, I'm going to have you turn your head to the right and to assess for any JVD or jugular vein distension. My landmark is going to be the sternocleidomastoid muscle. So I don't notice any distension there. Okay, while I am on under the neck as well, I want to just make sure that I assess for any parasites in his ear. Okay, I do notice that he has fasciculitis, also known as ingrown hairs. And the hair is uniform and coarse throughout. Right, you can bring your head back forward. Okay. As we continue on with the facial expressions, they are appropriate to behavior, as well as the feelings that he expressed prior. The facial structures, there are no edema, exophthalmos, or changes in skin color or pigmentation. There are no notable lesions or involuntary movements such as tics, fasciculations, excessive blinking, grinding, or... Now I'm going to assess the carotid pulses. I'm going to do this one at a time. Okay. Okay, pulses are moderate and equal bilaterally. I'm going to take the bell of my stethoscope and listen for any bruise. Okay, and there are no bruise on either the right or left. Moving on to the mouth, throat, and other sinuses. As we assess the external nose, we noted that it was symmetric. There were no deformities or lesions. As we assess the internal nose, with our otoscope. Can you hold your head back? We note no discharge, there's no bleeding, erythema, or edema. There is significant amount of hair in both nostrils, but no abnormalities or polyps noted. As we move down the face, we can reassess the color and consistency of the lips. The color is uniform and there are no significant fissures or chapping of the lips. Okay, so now we're going to assess the buccal mucosa, the gums, and the tongue. Okay, can you open your mouth for me? Okay. Let's see. All right, the mucosa is pink and moist. I do notice the linea alba on the right side of the face, on the right side of the cheek. It's just from typical chewing and biting movements. I do notice that his wisdom teeth have been extracted on both top and bottom. And he has 28 teeth. There's no exudate. Okay. Can you stick your tongue out and say ah? A little wider? Okay. As I know, the tonsils are about 1+ in midline. The uvula is midline as well and responded appropriately. Okay. Can you see your tongue? As we assess the tongue, it is uniform in color, light pink and moist. There are no fissures indicating dehydration. He looks like he has good hygiene. There is a little bit of white exudate on the tongue, but nothing significant to indicate candidiasis or thrush. The soft palate is intact. You lift your tongue up. Okay, we don't see any patches or exudate located underneath the tongue, which would indicate any mouth cancer. The palate doesn't show any jaundice as well. You can put your tongue down.